welcome to another exciting edition of From the Source. I'm your host, Elizabeth Johnson. Today, I'm excited to have as my guest a multi-talented leader of the Manhasset community, Jen Desena. Jen is Executive Director of Manhasset Coalition Against Substance Abuse, a nonprofit dedicated to improving mental and physical health of youths by resisting alcohol and other drug use and increasing mindfulness and service to others. An attorney by training, she is now active in local civic issues and service through the Catholic Church, through the St. Vincent de Paul Society, as well as fundraising for cancer research and prevention education. I'm happy to have my friend and colleague, Jen Desena, as my special guest. Thank you for coming on to this show, Jen.
Thank you for inviting me.
Well, tell us a little bit about your background and who you are.
Okay, well, I've been in Manhasset for about 20 years now, which makes me a long timer. I went to BC where I met my husband, and probably where I first got the idea of serving others. That was a big part of the Jesuit education, is to be a man or a woman for others. And I went to St. John's Law School, and it's interesting to realize it's a Vincentian school, and which is about serving the poor. And as a law student, I can't say I got that. I didn't realize. But now that I'm involved in the St. Vincent de Paul Society at St. Mary's, it's a beautiful thing to come back to. So when I moved here, I had my first son, Robert, and then I had another son 2 years later, and I decided to stay home with them. It was right after 9/11, and I stayed home for a few years. Yeah. And then one thing led to another, and there's so many active people in Manhasset doing great things, and I just got caught up in it. So I was home, and I managed to meet a lot of really amazing people who impressed me, and I wanted to be like them and give back to the community. So
you even had your own business at one point.
Oh yes, at one point I was making belts and keychains and ribbon things in my basement. Totally different. While my kids were playing trucks and trains in the basement, I was sewing little crafty things and selling them at the nursery school, which is where we first met, Northshore Nursery School.
Absolutely.
And selling them at craft fairs and making teacher gifts, and that was fun.
Yeah, they were beautiful. I think I still have.
Thank you.
So Manhasset Casa, how did you get involved with that? I know that it started up sometime in the early
2001. Yeah,
right?
It started in 2001 by some concerned citizens, some very generous people generous with their time and finances to get things going, get some events planned, and it was incorporated in 2001. And I got involved about 3.5 years ago. I was about to put my foot back into the lawyer pond when someone said, "Would you be interested in this?" And I thought, this is perfect. This is a part-time job. That means I can keep doing other community things I'm involved in. I have 2 teenage boys, and what an important time to start talking about this message of, delaying drinking and not experimenting with drugs. And so, the people on the board were very impressive, and I think they wanted me because I knew a lot of people. And that's the most important part, is to reach people so that, people don't feel alone. Nobody wants to do this alone, to feel like they're the only parent who's taking a more protective position. Parents want to stick together, and so that's a big part of what I've wanted to do, is just make it more normal to protect your kids, because these years, high school years, are crucial for their brains and for avoiding some pitfalls.
Absolutely. So do you feel like from the initial stages of CASA, which started at the beginning of the turn of the century, that the stigma that used to be associated with it has changed altogether, where now it's almost like a vital resource to have this coalition to support the parents and the students of the community?
Yeah, I think most times I say yes. It's getting easier. I think there's less stigma. There are hard days. Every parent has a hard day where they have to say, "I'm sorry, you know, this is not something you can go to." You know, an unsupervised rent an Airbnb in the city. You know, when you're 18 and your friends are 18, you know, these are the times that, you know, kids can get in trouble, and you know, you can get arrested, and people can take photographs. I mean, these days it's much harder than when we were young, because everyone has their phone out. So, and they're posting pictures of themselves and each other. So it's very easy to ruin a reputation. And so, you know, there have been some times where, you know, I've had to say, sorry, this is not going to be an event you go to. You know, it's not because I don't trust you, but it's because you shouldn't have the responsibility of, you know, having to call the police or call an ambulance. You know, that's a lot of pressure for a child. And so if a parent isn't able to handle that pressure, you know, why would a teenage boy be able to handle that pressure, you know, to do the right thing? Absolutely. So I think, you know, the conversation has changed recently it's evolving into mental health. More people are understanding that mental health is about mental fitness, and it's about refusal skills and coping skills, and these are the things that all people need. You know, adults need coping skills. Parents need refusal skills. You know, it's a strengthening, and so a lot more people are getting behind the message of empowering our kids with resistance skills and coping skills.
So basically what it's turned into is actually providing the tools necessary in order to face a situation, whether it's for the parents or for the child, because obviously it happens on both levels.
Right.
And I know that the message of Manhasset Casa used to be just for high school. Now we have pushed it down to elementary level. Is that correct?
Yes, we did a great presentation. We brought in LICAD, the Long Island Council on Alcohol and Drug Dependency, and we did a presentation for the 6th grade classes about vaping. So
okay, so now it's including substance abuse.
Vaping, sadly, vaping might wipe out everything we accomplished with anti-smoking. Because, I mean, all those people who stopped smoking cigarettes, I mean, teenagers, they didn't think it was cool to smoke cigarettes anymore. It was a very, very small number. But sadly, the vaping, you know, the Juul and the other vape products now look very modern and clean, and they don't smell. There's no cigarette smell in your hair. You know, it's a fruity smell, fruity or vanilla or mint smell. So, and people can do it in their car, in their classroom, they can do it all the time. But the nicotine addiction is just as bad, if not worse, because the nicotine salt is more powerful than the cigarette. So, and it's smooth, and a child who starts with nicotine will have a worse time trying to quit, because there's a psychological and a physical addiction. So, it's really it's a lot to put on a child to carry that addiction, to start with the chronic disease of addiction at 15. It's going to be a terrible burden for them when they go into college and you know, throughout life, to start with that. You know, an addicted brain means that you want it. They think about the vape, they think about the nicotine during the day. That means they're not learning as much in school. They're leaving the classroom because they need it. They experience withdrawal. You know, I mean, if you know anyone who smokes, it's the hardest thing to quit. Absolutely. So we did bring the vaping education to 6th grade so that they have those facts for themselves and they can say no before the temptation comes. If you wait until after their friends are vaping, they feel a little bit bad when you tell them vaping's damaging because they're worried for their friends, or their siblings. So it's important for them to get the message and have it sink in and have them believe it so that they'll say no when it's presented.
So, all right. The whole thing with the flavors, I know, is really what is the draw for kids. The question is, there have been studies now that ERs have been filled with children who have had been vaping. What happens that brings them to the emergency room? I don't know, so I'm asking.
They call it EVALI, E-V-A-L-I. It's e-cigarette vaping lung illness, but it's a very bad respiratory illness. They have narrowed it down to an ingredient called vitamin E acetate, and we had a great presentation the other night by Dr. David Fagan of Cohen's Children's Hospital. He said vitamin E acetate is like honey. So you put honey on the inside of your lungs and you can't breathe, and it's terrifying. And so the child seems to have pneumonia, but it happens very quickly, and they're terrified because they can't breathe. And sadly, they don't want to tell their parent that this might be why.
Okay.
But of all the cases, and the number is maybe, it's over 1,000, 1,600. Most of them involved vaping THC, and there's a lot of THC from some kids will take it from their friends. They don't really know where it came from.
Okay.
They don't know what's in it. So this ingredient, this vitamin E acetate, was in a lot of it. The number of deaths has been leveling off, but I think maybe 60 died from this.
Oh, wow.
We actually had a Manhasset mother come and talk the other night too. She's a pulmonologist at Winthrop Hospital, and she's treating teenagers who they're near death, and she's told them, you can go back to college, but if you do this again, your lungs won't survive because they've been so damaged.
Oh my God.
Right. So that was very alarming, and I think a lot of parents started paying attention to the news, to all these deaths.
Right.
The addiction is a much larger problem. Nicotine addiction is affecting all of them, and including the adults. Even adults who switch to vaping, they haven't quit. They're still addicted to nicotine.
Absolutely.
And the vape products contain just as many carcinogens as cigarettes, in addition to metal particles. So the long-term physical effects aren't even known yet because this is so new. Like the long-term effects of the metal in your lungs, and the metal actually goes through your lungs and into your kidneys and your liver. So there's a lot of problems with vaping. It is absolutely not safe, and the people who said it was safe were the people selling it.
Of course.
Because they still want their money. It's a lot of the investors are the tobacco industry, and they're about to lose a lot of money, and so they said it's safer than cigarettes, but they had no basis for saying it, and it's not.
Right. So I know originally Manhasset CASA started against underage drinking. Do you feel that has improved, and that less and less children are drinking at a young age, like middle school or whatever? It
definitely has improved. And one of the things we do is a survey every 2 years. We do a survey of 8th, 10th, and 12th grades so we can see the trends. And that survey is done across the country. They collect that data at the University of Michigan. It's called Monitoring the Future. So by us doing it every 2 years, we can compare Manhasset to Manhasset 2 years ago, and we can compare Manhasset to the rest of the country.
Right.
So across the country, the number of teens drinking is decreasing, which is a good thing. There's sort of a bad thing happening too, because more are using marijuana.
Okay.
And that's because they don't think it's the medical marijuana and recreational marijuana in some states makes people think it's medicine.
Right.
So that's an unfortunate trend. But the number of kids who are drinking underage is decreasing, which is good. Even in Manhasset, it's decreasing, which is good. The thing is that in Manhasset and really on Long Island, the amount of drinking is 2 and 3 times what is going on in the rest of the country. A lot of this is it's cultural, it's tradition, it's just what we know. But that normalizing is a problem because that people think that they have to let their kids drink.
One of the things that I understand, I mean, when we were younger and we would steal the drink or whatever, it was typically like beer. It really wasn't hard liquor so much. But nowadays, it is hard liquor. And they don't mix drinks. It's like straight out of the bottle. How did that shift occur? I mean, I don't know if there's, why, like, it's to me unfathomable because hard liquor is difficult to take straight, and these kids, I guess, with the flavors, it must be something.
Yeah, unfortunately, I think especially girls will prefer to drink vodka because it has less calories than beer.
So it's all the figure.
So they're so they're being health conscious.
Right. Okay.
But that's a scary situation because one of the things CASA does is at the end of senior year we have a program called College 101, and that's about harm reduction, so that we know you're about to go off to college, and we want you to be able to call for help to save yourself or save a friend. So one of the things we do is we'll fill a Poland Spring bottle and show that contains 12 shots. So when you talk about how many drinks you're having or what's the amount of a drink, you can't walk around with a Poland Spring bottle of vodka. That can kill you.
Well, and that's the impact. I mean, they don't really realize it. Just they're drinking it and they're thinking, oh, nothing, and then it hits them so fast, like a sledgehammer, and they're in the emergency room.
Right.
Because of that. Yeah, it's really amazing.
And that actually reminds me of something that's really scary about marijuana, is the edibles. Kids will they'll have something and they don't realize how strong it is, and a lot of kids end up in the hospital with marijuana poisoning because of an edible. They didn't feel it, so they had some more. You have no idea what's in that. So the number of poisonings from marijuana is going up because of that.
And now marijuana, I've been told, is so purified in its form that it's nothing like it was in the 60s and 70s or even 80s, whatever. I guess they filtered out whatever.
It's very pure. They grow it, hydroponically. You can dry it. There's something called shatter that's, it's like 90% pure. The levels of THC are higher, so much higher than the leaves that people, had at a concert, 30 years ago. And vaping marijuana also, it's strong. There's much less odor. It's easy to use. It's not detectable. The way some parents, some people think, marijuana, that's been around forever. It's not the same thing at all. It's an entirely different thing. It should have a different name.
Right.
Because it's so strong and addictive.
Do you think that, I know that in New York, it's obviously only for medical purposes, but outside, it's available for recreation. And now that they are mixing it in, well, they've always mixed it in food. Is there a way that like some legislation can come through with the percentage of, and what is the impact?
We're not there. We're not there. That's why legalizing it now, there's so many unanswered questions. And one of the reasons there's so many unanswered questions is that it is a Schedule 1 narcotic, meaning you can't even have it for testing. Federally, it's a Schedule 1 narcotic.
But wait, what does that mean? Schedule 1?
There's Schedule 1, Schedule 2, right. I'm almost getting out of my league now. But it means that
does a cop?
It's federally illegal.
Okay.
It's still illegal to have it at the federal level.
I see, okay.
And because of that, there has not been enough testing done to know, quantities. That's why we don't know if people should be driving. Nobody, even people taking medical marijuana, we don't know if they should be driving.
Right.
We have no idea how long it takes for it to get out of their system. And it's because it's not quantified. I have a neighbor who overdosed on marijuana that she bought at MedMen. She spoke with someone there who told her how to buy it, how to take it. She went home, she took it, she didn't feel much, she took some more, and then she was crying on the floor and suicidal and called her husband to please come home because she was afraid that she was alone in her house with her young son and suicidal. And, this is for MedMen. For medical marijuana. They just don't know how strong it is. Right. So we're really not ready to sell legal marijuana. There's just too much unknown about it.
Okay. And it's a stupid question, but how are these kids getting the marijuana to smoke here? I guess they can cross the state line, or is it?
Well, because it's, the black market hasn't gone away.
Right.
And states that have legalized have a bigger black market. Like it's easier for the black market to operate once recreational marijuana has been legalized. So they actually have an increasing problem. But in New York, there's still illegal marijuana being grown and being imported, and drug dealers sell it, which is very dangerous because anything a drug dealer is selling might have fentanyl mixed in.
Right.
Fentanyl is being found in everything. A trace amount can be fatal. That's a whole new ball game called one and done. We're out of the realm of addiction completely. One and done means some college kid tries something one time and that's it because it had a trace amount of fentanyl in it.
Oh my gosh.
Yeah. Yeah. No, fentanyl is so strong that it's being looked at as a terrorist threat.
Wow.
Yeah. And it's very easy to import. It's very cheap, and a tiny amount can kill.
So I know that originally CASA was started with federal funding, and you received a grant, and it was renewed, but it was only allowed to be renewed twice.
Right.
And that was for a period of 5 years?
10 years. It was 5 years and then renewed for 5 years.
Right. Okay. So that's 2011, whatever. How is Manhasset going forward with, and where do you get your funding from?
Well, we're funded by the Manhasset School District primarily.
Okay.
And they've actually funded CASA even before it got the grant. So going all the way back to 2001, the Manhasset School District has funded CASA.
Okay.
And then at some point, the SCA, which is our PTA, the SCA started funding CASA as well. So they're the biggest partners and most consistent. So the Manhasset School District increased its funding after we lost the grant, so that we'd be able to maintain one part-time employee. And at that point, the SCA increased its funding so that we were able to maintain 2 part-time employees. And now for 2 years, the SCA has done that. So, and then and we do get other grants from the community. We're a 501c3, so it's easier for us to take donations. And we've gotten Manhasset Community Fund grants and Green Tree, Good Neighbor grants. We recently received a donation from the Manhasset Youth Council, which for many years served the youth, but needs changed and the activities changed, and they were looking for who is still actively serving the youth, and so they gave us their remaining funds, which was wonderful.
That's amazing. That's great. So talk to me a little bit about if you start on the road of let's say drinking, okay, and what that leads to. Because I know it's definitely a story that has unfortunately been told time and time again, and it doesn't change.
Right.
So
yeah, there's several factors that can come into play. Science has figured out that if you start drinking before the age of 15, you're 4 or 5 times more likely to develop a substance use disorder, which is a nicer way of saying addiction or alcoholic. But a substance use disorder, that's something that they'll struggle with for life. So if you delay, the brain is still forming until 25, and that's why car rental companies won't they won't rent a car unless you're 25, because they know and the frontal lobe is the last part to form, and that's the part that's responsible for decisions, and understands long-term consequences and judgment. So, letting kids make all these decisions for themselves while their brains are forming is just not strong parenting. It's just not, they need more help. They still need boundaries.
Right.
So every year you can delay exposure to alcohol or nicotine, any addictive drug, is better, because the brain is forming a little bit more. You're starting to understand there's consequences. So delaying the first exposure is really important. Other things that matter are your genetic history. If you have any genetic history of addiction or mental health issues, depression, these are things that, families need to share. This is something that a teenager needs to know. That, just if you had a family history of cancer, you would know that. You would know, I have a history of colon cancer. I'm going to have my first colonoscopy earlier. Or, if you have a history of breast cancer, I'm going to be scheduled for earlier mammograms or more frequent. If you have a history of addiction or, mental health issue, you have to be more careful. And if you are, you have a better chance of success.
Thank you so much for coming on the show. That's all the time we have for today. Thank you for watching From the Source. Stay tuned for more in-depth conversation with interesting people and neighbors from your community. Until next time, au revoir.